Good day. Today I'm going to talk about pregnancy, heart disease risk, obesity, and even your offspring's risk of having and developing heart disease in the future. So, this is Diamond Fernandez uh, from the Heart Fit Clinic, your leaders in heart health. And today, what I want to talk about is pregnancy. And the study that was done that I want to allude to is that there are 40,000 pregnant women, and they found that the children where the mothers were diagnosed with gestational diabetes had a substantial increase at risk of having obesity in their offspring. And then what was worse is that the mothers that were not even, they didn't have gestational diabetes, but they had high blood sugar, were at 13% increased risk of developing obesity as well. And so it's very important that heart disease starts early in pregnancy. And so how were you carried and what's your risk of developing heart disease? We have to look at our mother's risk and how we carry the children as well. And so yes, women who do have gestational diabetes, women who have high circulating blood sugar when they're pregnant, does put the child at increased risk of heart disease in the future because they're more at risk of obesity. So that's one aspect of it. And so if that's the case, then it becomes more important, especially in childhood, to make sure that they don't go down that path of developing a heart attack or stroke, because we know obesity is a huge risk factor for developing diabetes and even heart disease in the future. So that's one aspect of it. Now for the mothers who, obviously pregnancy is a challenging thing for women. And when they go through that, it does put their body at increased risk of developing heart disease. And so I just want to quickly talk about that part of it too. So women that do develop high circulating blood sugar or do develop gestational diabetes, it's very important to then focus on weight loss after childbirth. And it's so important because now the mother is putting herself at risk of having heart disease in the future and diabetes in the future as well. So be careful of that. Obviously, there's lots we can talk about when it comes to heart health and preventing heart disease risk. But the big point or the big takeaway from this is that if you are having diabetes, gestational diabetes, or high circulating blood sugar when you're pregnant, take care of yourself as the pregnant mother, but then also the offspring as well, as we always should be doing. But now understanding that there's that increased risk of having problems in the future for the child as well. And so lots of great tips that we can talk about and a lot of rabbit holes that we can go down, but I'll keep it there for today. And we look forward to talking tomorrow about how we can prevent and reverse heart disease with some other great heart health tips. Here's to your heart health success. Make sure you hit the subscribe button above, and we look forward to helping you live happier, healthier, and longer.